Hi, welcome to 5 Minute Video Study for the NCE. We are covering the clinical focus, and today we are doing subcategory P, insomnia sleep issues. We know that the body needs rest. That is a some genetic component of the human body, and if they don't have, and if it doesn't have rest, then it is not functioning at an optimal standard. So today we're going to be talking about insomnia and sleep issues. So let's first talk about um, the notion of insomnia disorder, which is a classification in the Diagnostic Statistical Manual 5. And based on the criteria, the DSM puts out criteria, and if you meet that criteria, then that disorder meets the guidelines. So the DSM states that first criteria is a dissatisfaction with sleep quality or quantity. So either they're not getting enough sleep, or the type of sleep that they're getting is not to the satisfaction of that individual. The other criteria that the DSM-5 states is the complaint of sleep difficulties, difficulties initiating sleep, difficulties maintaining sleep, early mornings awakening, or non-restorative sleep. So this is sleep that it's being interrupted. It's not following the sleep cycle, and that is causing difficulties for that individual. The third criteria states that significant distress or interference with persons functioning in daily living, and that's due to the difficulties in sleep. So not only do you need to meet the criteria for the difficulties in sleep, but this criteria would be a significant interference in day-to-day functioning. The fourth criteria for insomnia disorder is that sleep difficulties occur at least 3 times a week, and it's persistent within at least 3 months. So it can't be just a short term. There has to be a multi through at least 3 months of the process. And the last criteria, it states that sleep difficulty occurs despite adequate opportunities and circumstances for sleep. So really what they're saying is, we cannot rule out other issues such as medication issues, or other things that could inhibit, maybe the noise level where they're living, or other things that could inhibit the sleep. So with insomnia and sleep disorders, you do have quite a bit of criteria that need to be met, and these are issues that many people um, face, because it can be very frustrating. So as far as kind of the treatment for a diagnosis such as insomnia, or other sleep disorder conditions, most best practices mention therapy in order to see if there's any obstruction within the realm of mental health that could be interfering with sleep quality. Interventions such as medication as well could be recommended, and looking at both therapy interventions as well as medication is usually what most practitioners recommend for insomnia disorder and or any sleep associated disorders.